So what we're setting up to do is have regular meetings with colleagues who work in general practice, as well as paediatricians and other people that work with children, so mental health teams, the health visitors and school nurses and the family hub get together to think about ways that we can help to support children where the GPs particularly are asking for some further advice about what else they can do, in the hope of getting the right services involved at the right time. So there's a wide range of different things that a GP might want to ask advice about. So some of it may be children who've got quite significant health problems that are already seen by paediatricians, so children who may have things like cerebral palsy or complex health problems, and the GPs and other people are wanting to think, what else could we do to support that young person and to make things as good as they can be for them. But the others would be children perhaps where they're having lots of symptoms to do with asthma, or children who are having little babies having lots of problems with irritability and difficulty with feeding, and lots of problems with colic and pain. And so it's a place where the GPs and other professionals involved can ask questions about those children to think, what can we do sooner, rather than necessarily waiting for that child to be seen in a paediatric appointment or having to go up to the emergency department up at NSET. So the child get referred, it's really, at the moment, it's going to be the general practitioners largely, or members of the practice staff, who will bring a child for discussion. And your GP would talk about that with the young person, certainly with the parents beforehand, to make sure they're happy for that young person to be discussed in the MDT, in the meeting that we have. And it's something that we expect GPs to be talking to parents about when they're seeing them in their own clinics. But certainly parents can ask as well to have that for the child to be discussed in those meetings. The main benefits of this way of working, I think, will be to really support families and children to get the help and input that they need much sooner, and in the right way as well. So hopefully reducing the number of appointments they have in outpatient clinics, or the number of times that they have to go to the emergency department, or even see the GP or other healthcare professionals. So it'll also be more coordinated and better access, and you'll get treatment closer to home, and you'll get treatment, the right treatment, rather than waiting for appointments.